Doctors are now saying all kids should be screened for potential heart problems. Before, it was just recommended that student athletes be screened. Now, this is a new recommendation from the American Academy of Pediatrics, and Dr. Sandra McKay is co-chair of the Texas chapter. She's also associate professor of pediatrics at the McGovern Medical School at UT Health. Thanks so much for your time this morning. Let's talk about first why the shift to all students, regardless if they play sports.
What we know about children is that all children can be impacted by sudden cardiac death. And so the student athletes are the ones that tend to catch the media news and tend to have more stories done about them because it's often done in a very public venue. But younger children, children in school, children at recess, they also can suffer cardiac events as well. And looking back at the recommendations from 2012 and the data and where the deaths are, the AAP decided that it was time for us to just screen all children. It was safer that way.
Yes, and doctor, is there a certain age or grade level when all kids should start being screened?
Typically when they start hitting that school age is when we should start screening them.
Okay, so as early as 5 or 6 years old then. Okay, I want to show some video of the Danish soccer player who collapsed last week on the field. Doctors said he was gone, but was resuscitated with a defibrillator. I mean, scary moments here. Is there a condition that puts someone like this or a child at risk of sudden cardiac arrest?
There are many conditions that can put children at risk for sudden cardiac events. There are congenital conditions, things that they may be born with that they might not know about. There may be problems with how their blood vessels are joined into the heart. They can have rhythm issues, so like how the electricity conducts through the heart can sometimes be abnormal. There's a laundry list of things that can go wrong. The video that you're showing was really heart-wrenching, and I've seen it, and it's something that definitely highlights not only the importance of doing screening, but also that, even with something as simple as like a screening EKG might not have picked up all of those things because it's only one snapshot in time. So might not have picked up what the soccer player had going on, but more important, he had access to medical professionals immediately, and he had access to an automated external defibrillator immediately. And those are things that are life-saving.
Yes. So for parents watching, what exactly is the screening that's recommended? Is this an appointment that parents would need to make separately, or is this something that would ideally be done at the annual well check?
It is something that we incorporate into the annual well child visit with the pre-participation sports physical. So when we know a child is going to go in and play sports, we do a 14-point evaluation on them. Otherwise, the screening for sudden cardiac events in children is a 4-question screening. 2 questions relate around family history, and 2 questions relate around child's physical activities and kind of how they're acting during their activities. And, families might not notice they're even being screened because it's not like we're going to, check box each question as we go along. I may be asking some questions earlier, some questions later. But with your pediatrician, what you and the family will do is we'll make a plan and we'll say, wow, you said a few things here that were concerning to me. I'm either A, going to want to order a test, or B, might want to send you to the cardiologist to get more thorough workup. And we'll make that plan together, but we can definitely incorporate that as part of the annual well visit.
Okay, Dr. Sandra McKay with UT Health talking about the new recommendations for all children to be screened for potential heart conditions. Thank you so much for your time. Appreciate it.
Thank you.